Hi, very good evening, all of you. So it's been quite a while since we had a dinner session or breakfast session. So welcome to our dinner session after a long gap. So how are you guys doing? And in this live session, we'll focus on the following case-based question, right? And before we start, please confirm the audio and video streaming, thumbs up or thumbs down, right? So I hope it is all streaming fine. Yeah, thank you, Sriparna, for your swift comment. So we'll start with the following premise. And before that, I just wanted to highlight certain things. The current situations are very challenging as we're all experiencing the same. We're losing our loved ones and we are made to, make some arrangements for people whom we love and care under these very challenging situations. Like, for suppose, in my case, to deal with my mother, to take care of her. In your case, in fact, I've been getting plenty of mail saying that either you or your relatives are testing positive for corona and so on and so forth. The current situations, for sure, are very challenging. And usually, when we discuss these things, if you remember, I keep telling you that any situation which is very harsh or negative is an opportunity. Or for that matter, any challenge which you face in life is a sign of opportunity. When I say this, you might get angry, but before you get angry, please listen to this. When I use the term opportunity in this context, it means it's an opportunity for us to explore and test our determination and patience towards that particular challenge. So this pandemic is obviously very challenging to each and every one of us, and it's a test for each and every one of us. Test for our determination, test for our resilience, and whatnot. So if you believe in yourself, all you need to do is just hold on, right? The exam dates have been released. We're facing so many challenges, and the moment we go outside, we're putting ourselves at risk. So let's keep all these things aside. What really matters is how we perceive here. Ultimately, even if I'm tested positive for corona, what really matters is how I'm dealing with the same here. What really matters to you is how you're dealing in here, internally. So make sure that you're taking care of that. And for any further assistance or guidance, you can always get back through mail. So the current situations are challenging. And whenever there is a challenge, there is an opportunity. And this is an opportunity for you to explore yourself and progress accordingly. Take my word, right? So with these initial comments, I hope it's all fine. Now let's proceed with our first question, a case-based question. Let's discuss the premise first and then deal with string of events or questions. So first and foremost, as you can see, a 29-year-old female patient, 29-year-old, visits your clinic with a chief complaint of notching of incisors, no history of trauma. So you rule out history of trauma, and she is getting married soon and wants her front teeth to be perfect. She is tailor by profession for 14 years. See, consider this as a model case-based question. Whenever any case-based question is given, there is always a clue or some clues mentioned in that particular question. So always look for those clues. With practice, it's only a matter of few seconds. In this case, if you carefully observe, this particular statement is a clue. I mean, the duration as such is fine, but shares tailor by profession. So, right from 15 years of age, usually in our culture, right from very young age, women they sew and they are into this, isn't it? So, shares tailored by profession for 14 years. So, any case-based question, try finding out clues. In some cases, you'll be given radiographic features. In some cases, clinical related parameters or lab parameters or histologic parameters. So always look for clues. It will make you answer related questions very, very easily and also confidently. So you already answered the question based on the keywords or the hint. Well done. Now, notching of incisors in this particular case, before you answer, let me show you the clinical image. Let's see if you're going to change your answer. So this is the clinical image. So with respect to central incisor, right? Maxillary central incisors. Observe the central incisors incisal edge carefully. And now you tell me what could be your diagnosis. I see some of you saying attrition, most of you saying abrasion. There can be attrition, but in this particular case, if you observe the central incisor, you can see a notching. So it's a clear-cut case of abrasion. So abrasion is wearing away or loss of tooth substance or tooth material because of some abnormal mechanical form or abnormal mechanical means. Whereas erosion, there is some chemical process or abnormal chemical process happening without involvement of bacteria. Whereas attrition, Chavi, a few of you mentioned, attrition is tooth contact leading to loss of tooth substance or tooth material. Abfraction, loss of tooth material in cervical areas because of tensile compressive forces during flexural bending of tooth or teeth. So this hypothesis, studies are still going on to prove the same. So notching in incisors in this particular case, Shears-Taylor, bobby pins, habitual opening, right? So it could be mostly abrasion. Good. Now let's move on to the next question. Notching evident in this case. So abrasion, which is evident in this case, is physiological, pathological, both can't be categorized as physiological or pathological. So which one do you think is more appropriate answer? A, B, C, or D? So now I see mixed response. Some of you say it's physiological. Rituja says it's physiological because she is Taylor by profession, so it has to be physiological. So pathological both can't be categorized. Now I see one of you choosing can't be categorized, which is very interesting. I mean, Schaefer's has given a categorization, so let's follow the same. If you create your own book, then you can come up with your own hypothesis. Good. So this abrasion is pathological than physiological. In normal case scenarios, in normal human life, we don't see abrasion unless and until you're using certain third means to rub on your tooth or teeth. The best example being toothbrushing, right? We'll get back to that. So abrasion is more of pathological than physiological. What about attrition? One of you previously mentioned this as attrition. So what do you think about attrition? Is attrition physiological or pathological? This, I think, will be challenging. Yes, attrition is physiological. Now, let me ask you another related question. Where do you find abrasion? Occlusal surface, incisal surface, proximal surface, buccal surface, or lingual surface? On which surfaces can you potentially find abrasive lesions? Now, this is very, very important because I'm going to present you an interesting fact related to this. Yes, incisal or occlusal as evident in this particular case. Buccal, yes. Even proximal, are you sure it's proximal? Buccal in the sense, okay, cervical abrasions, tooth brushing and all, that's understood. But how can you answer it as proximal? Yeah, how can you answer it as proximal? Well done. Even proximal is right answer. There can be possibility of abrasion even proximally. No, we're not talking about proximal attrition, but we're talking about proximal abrasion with faulty use of toothpicks, even dental floss. This is very, very important, right? So don't rule it out. I hope you got my point. Now let's move on to our next question. Well done each and every one of you. Most common cause of these abrasive lesions on root surfaces include, so which among the given options is the most common cause of abrasion? So in this case, bobby pin, habitual opening, that's fine. Let's keep it aside. Now, among the given causes, which one do you think is the most common cause for abrasive lesions on root surfaces? So is it use of toothpicks? Is it dentifrice? Is it trauma? Or is it food habits? Dentifrice, I mean, being a dentist, how can you say it's dentifrice? Does it mean you want the patient not to use dentifrice? I know I have two pets. toffee tiger, they never use dentifrice and their teeth are still very clean. Of course, there is plaque, but there is no tartar buildup. I'm really surprised. I'm always amazed by their arrangement of teeth and how clean they are. Pets or dogs, stray dogs, never use dentifrices. So, are you trying to advise the same when you choose option B? Yeah, so there can be a number of causes, but according to Robinson, as mentioned in Schaefer's, dentifrice, toothpaste dentifrice is the most common cause of abrasive lesions on cervical areas on the cementum, I mean on the root side of CEJ, onto the root. Why? Because root surface gets abraded more frequently. Cementum gets abraded more rapidly, vigorously compared to enamel and dentin, right? So that's another interesting fact which I'll try to discuss at the end. So the most common cause of these lesions on root surfaces include dentifrice. Now, let me ask you a related question. Dentifrice contains, it's nothing but toothpaste, let's assume. So what are the abrasive materials present in your dentifrice? You're using toothpaste regularly, right? I hope so. So what are the abrasives which are present in this dentifrice? Yeah, you can try answering that. And in the meantime, let's move on to the next question. Okay. Yeah, of course, silicon. Good, Akshay. Fast and furious today. Yeah, silica oxide. Yeah, calcium carbonate. Okay. Silica oxide, aluminum oxide, powdered polyvinyl chlorides. Refer Karanza. It's given very clearly over there, right? Very good. Now let's move on to the next question. In such lesions, I tried to avoid using the word abrasion or abrasive lesions because that would make you answer the question, but still you answered it very well. So in such lesions or abrasive lesions, the rate of secondary dentin formation is sufficient to protect the tooth against pulp exposure unless it's an extreme variant. Do you agree with this statement? Right or wrong? So what do you think? Yes, very good. Good to see your answers. Yeah. So, do you agree with this statement? Is it right or wrong? In abrasive lesions, the rate of secondary dentin formation is sufficient to protect tooth against pulp exposure unless it's an extreme variant. Or else, everyone has to visit a dentist. If this were a false statement, then everyone of the population should be visiting us with pulp exposures and endodontics. Implantology would be a very, 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 very popular. Yeah, it's a true statement. Body takes care of everything, literally everything, not just tooth for that matter. Any organ, eyes, kidneys, lungs, liver, take any organ, body system. Body is so sophisticated that we really don't appreciate it, but it is so much sophisticated that it takes care of everything, literally everything. Recently, I've been seeing many ads in TV. They say use this honey, use this Ayurvedic product so that you can build up your immune system. That's all nonsense. Being doctors, being science graduates or postgraduates, we should understand that we have the most sophisticated weaponry in the form of humoral or cell-mediated immune system. And these idiots are trying to market their product saying that take this product, you will be, and they'll project a shield, three-dimensional shield covering us if we take that product, which is complete nonsense. Good nutrition is essential. There is no doubt in it. But magic doesn't lie in some marketed product, isn't it? So usually, any abrasive lesion or any stimuli for that matter, we see tertiary dentin formation, which you're all very much aware of. So secondary dentin formation is a continuous process. It happens throughout life, isn't it? As you're all aware of. So this rate of secondary dentin formation is sufficient to protect tooth against pulp exposure in almost all cases, unless and until this abrasive lesion is more vigorous, violent, or rapid in entity, right? So I hope you got my point. So this statement can be considered as true. And let me ask you this question. We're talking about the most common cause of lesions these abrasive lesions on cervical areas. You mentioned it as dentifrice. And does it mean, let me ask this question, does it mean we should not use dentifrices? Does it mean we should not incorporate abrasive particles in this dentifrice? So what's the solution to this? What do you think? Yeah, of course. Even tertiary dentin forms. There is no doubt in it. Even tertiary dentin forms. But usually, when you observe the timeline of events, the rate of secondary dentin formation, which forms throughout the life, is sufficient, to buffer the pulp against the stimuli. Because once the dentinal tubules open, once the odontoblastic processes are irritated, but still the pulp is intact. It's still vital. Contributed by secondary dentin, of course, tertiary dentin as well. We cannot rule it out. I mean, if you still have doubt, refer Schaefer's and get back through mail. I can clarify it for you. So that's the advantage we have with standard references, isn't it? Exactly. Well done, everyone, Anuja. So it's because of injudicious use or improper brushing technique that's causing the problem, not dentifrice as such. This is contributing, but with judicious use, with proper technique, we can manage. It's like trying to measure risk versus benefit. Even though there are certain risks, minor risks, but the overall benefit which we derive by using dentifrices or abrasive particles. In fact, in one of the studies, it's mentioned that incorporating these abrasive particles increases the efficacy of toothbrushing abrasiveness by almost 40 times, right? So that's something which is mentioned in Karanza. Good, very good. Now, let's move on to the final question. What's your treatment plan in this particular case? So 29-year-old female, she's saying like she wants to get married soon. So what's your solution to those incisal notching? So advise the patient to discontinue her profession. Don't bother, no matter how I respond, no matter how my facial expressions are, don't bother. Just look into the option and try to answer the same. So advise the patient to discontinue her profession. No tail, don't be a tailor. It's a bad profession because nowadays it's all ready-made, marketed by companies who employ tailors again. Tell her that perfect, here she wants perfect. So tell her that perfect or perfection is a myth and she should be happy with what she has. So philosophical approach, right? And then option C, advise composite restoration. We should survive, right? And finally, advise coronoplasty. So which one do you think is more appropriate answer? So none has chosen either A or B. I'm really sorry. I expected at least one of you to choose either A or B. By the way, don't you think this perfection or the concept of perfection is just one perspective? There is nothing like absolute perfect smile, right? In some cultures, diastema is acceptable, which we were discussing in one of the debate sessions previously. In some cultures, notching is acceptable. In some cultures, the studs or diamonds or ornaments on teeth are acceptable. What do you say to that? Oh, Krishna, I'm really sorry. Your mother is a tailor, so you would definitely not choose option A, right? Good. Even my mother used to, do all this sewing and all. Yeah, I'm really glad that your mother is also a tailor. Good. But in Indian culture, it's more of a hobby, right? Yeah, rather than a profession, it's more of a hobby. Ankur says we are here to make perfect smiles. That can make or rise another controversy. So, what is this perfect smile? The smile which is displayed by some Hollywood actress or by some Hollywood actor. Do you call that perfect smile? Okay, that would be a very good marketing strategy. So, we can go for composite restoration, even though it's asymptomatic, for aesthetic purpose, you can go for composite restoration. Coronoplasty, usually it's done in case of sharp edges or pointed areas of tooth or occlusal adjustments, right? To promote favorable forces within the oral environment, right? Coronoplasty, that's a total separate entity. So there's no point in doing the same. So advised composite restoration among the given options would be more appropriate, right? Okay, fun fact. So finally, I tried to incorporate something fun and important and relevant for an entrance perspective in each of these sessions. So fun fact which I wanted to discuss is, as you guys are aware of, using dental fries, cervical lesions are most commonly seen. Abrasive lesions are most common on cervical areas, especially with use of dentifrice in faulty brushing technique, like scrub technique. And also, as you know, right-handed people. So this is my right hand. We often find abrasions or abrasive lesions on left side, especially canines and premolars, as you're all already aware of, and vice versa. Left-handed people tend to brush more on right side, so abrasive lesions more onto the right canines and premolars. Now, the interesting fact which I wanted to present is, why do you see these abrasive lesions only on exposed cementum or root surfaces? It's because dentin is, let me use a black ink pen or black marker, because dentin is or abrades almost 25 times greater than that of enamel, 25 times more than compared to enamel. Whereas cementum abrades almost 35 times greater than that of enamel. So if enamel abrades by 1 unit, so dentin abrades by 25 units under the action or influence of abrasive containing dentifrice. Cementum abrades 35 times more than enamel. That's the very reason why you find abrasive lesions on the root side in the area of CEJ with associated gingival recession can be considered as pathological migration, isn't it? Right? So these are some of the things which I wanted to highlight in this particular video. The dinner session, our first dinner session post lockdown, we can consider. So I hope the session is informative, and we'll come up with more and more sessions with a variety of topics, right? And I'll let you know if at all there is a live session. I'll let you know at least 5 to 6 hours prior, so that you can be prepared and adjust your other things accordingly, right? At least 5 to 6 hours prior. Today I declared it at 6 p.m., but from next time I'll make sure that I'm letting you know at least 5 to 6 hours prior. As I said, every day we're facing numerous challenges. Personally, I'm facing several challenges. So I don't know how my day is going to be, right? So I need to manage certain things personally as well, along with professional aspects. So at least 6 hours, buffer time of 6 hours, right? So I hope that will be helpful for all of you. And I hope this session is informative as well. And before we conclude, we have this habit of summarizing all that we discussed so far. For those who are attending this session late, latecomers are supposed to stand on bench, first criteria. And second criteria, please listen to this. So this is a case-based question. A 29 female patient has come to your clinic with a chief complaint of notching of incisors. Clue. That's one clue. You can consider that as a clue, right? Always search for clues in case-based questions and consider it's very, very important. And she is getting married soon and wants her front teeth perfect, anchored, perfect teeth. She is tailored by profession for 14 years. So right from 15 years, she has been into this profession. So which indicates that habitual opening or using bobby pins, right? It can lead to notching. I'll also show you some clinical images at the end of this session, right? Don't forget. And notching in incisors is due to abrasion. And notching evident in this case is, so abrasive lesions are pathological. They cannot be considered as physiological. And the most common cause of abrasive lesions on root surfaces, use of dentifrice, according to Robinson. Other causes include bobby pins, pipe stem smoking, as you all are aware of. So in such abrasive lesions, the rate of secondary dentin formation is sufficient to protect tooth against pulp exposure, unless it's an extreme variant. It's 100% true, right? That's how our body is managing its teeth. Even when you are doing this faulty brushing, horizontal scrub technique. We wake up early in the morning, we cannot angulate it at 45 degrees and all these angulations and all. We simply take some paste, not even peanut sized, whatever amount comes onto the bristles, and then horizontally, as if we are trying to clean a wash area using a big brush and hard pick, as Akshay says. So horizontal technique, but still oral environment is able to manage the harm which we are causing or eliciting because of thanks to secondary dentin and as Mano said, including tertiary dentin. So what's the treatment plan? Advise the patient to discontinue profession. Okay, go for composite restoration, as you have seen the case. And fun fact, incorporating abrasive particles, like as you said, silica, alumina, chlorides, polyvinyl chlorides, increases the abrasive efficacy of toothbrushing by 40 times. And this abrasive, like we discussed about silica and all, they constitute almost 20 to 40% by a composition in a particular toothpaste, in any particular toothpaste in general. And when you compare the abrasive susceptibility of various uh, dental tissues to these dentifrice, dentin abrades 25 times greater than enamel to a very minimal extent, and cementum abrades 35 times greater than that of enamel. And then this is one of the clinical image which I wanted to project. So this is obviously from Schaefer's. You can see clearly a V-shaped or wedge-shaped defects. So you can see V-shaped, wedge-shaped defects. And abrasive lesions, they are more wider than deep. You can see how wide they are. You can see pathological migration of gingiva. So they are wider than deep. And another conspicuous feature is the angles are very sharp. Either the enamel margin or in the depth of the lesion, you can see the angles being very, very sharp. Okay. And pipe stem smoker, you can see the outline conforming to the pipe stem, shape of the pipe stem. So all of these fall under abrasive lesions, right? So bobby pins, it's a habitual opening using with bobby pins, because of which you can see abrasion. And even dental floss and toothpicks can cause abrasion. So it's not that these materials cause abrasion, so we have to discontinue uses because we are observing our pets. No, it's about proper technique. Simple, right? I hope it's useful. And for any further queries or assistance, you're more than welcome to get back through mail at proudtobedentist@gmail.com. Hope you enjoyed our first dinner session. My stomach is full. Right. I'll let you know next session timings very soon. Have a lovely day. When I say lovely day, there is still some day to those who sleep at 3 o'clock or 4 o'clock, or those who are planning to sleep early. Have a wonderful sleep, right? Because we have 5 a.m. session coming up tomorrow. Love you. Take care. Yes, attrition is physiological. Exactly. Yes, whatever the oral cavity does to itself, it's physiological. Whatever you try to do, it's all pathological, isn't it? So brushing your teeth is a classic example of pathologic activity. It could be a controversial statement. Then I always have this doubt. I observe my pets. Toffee never brushes her teeth. I've never seen Toffee brushing her teeth. I've never seen Toffee gargling her mouth. But still, okay, there is some oral malodor for sure. But her teeth are very clean. If you want a demo, I can demonstrate in the next live session. The teeth are very clean. There is plaque, but there is no tartar buildup. So what could be the reason? Diet. So it has something to do with diet and many other factors. Yeah. Okay. Okay, guys. Have a great night. Take care.